Hello, my name is Dr. Ron Daulton Jr. and in today's video I want to talk a little bit about why a lot of the treatments that your doctor recommends for a bulging disc or a herniated disc or really any type of a spinal disc condition, they typically do not work well, or what you'll find is that sometimes they help but they don't last. They don't work for the long term. And so I want to cover why that is and what you can do differently in order to get a better result from the treatments that you're utilizing for these types of conditions. Now, in order to understand why these treatments aren't effective a lot of times, we have to look at the actual disc itself and see what's really going on with these types of conditions. So if you look at the image here that I have on the video right now, what we're looking at is a normal spine, and on this left image here you can see that we're looking at it from the side view, and you can see we've got the bones stacked on top of each other, and then in between each set of bones is the disc. And if we take this disc and we flip it up to where we're looking at it from the top down, this is what it would look like on the image here. So the normal healthy disc actually has a strong outer covering that we call the annulus fibrosus, and it has a softer jelly-like center called the nucleus pulposus. And in the case of a bulging disc or herniated disc, what typically is going to happen is that if we focus over here on the right hand side at the back of the disc here, what you'll notice is that the disc will start to bulge because it's been injured for some reason, and eventually what's going to happen is that it's going to apply pressure to the nerve that it lives directly behind it. Now, with these types of conditions, there are two types of pain that we're looking at. The first one is called discogenic pain, and what that is actual pain that's experienced because of the disc itself. Now, most people would believe that that is the major cause of pain, but really that's not the case. What we know about the anatomy of the disc is that there's not a lot of nerves that actually go to the disc, and that is established like that for a very important reason. The major function of the disc is that it absorbs shock for your spine, and it prevents the bones from rubbing together. So if you think about it, it doesn't make sense to have a lot of nerves going to the disc, because if it's absorbing shock all day, you would be hurting all day basically. So there's not a lot of nerve supply going to the disc. So a lot of times what happens with these conditions is that they tend to sneak up on you because you don't feel the pain when the injury first occurs. What really causes most of the pain is the second type of pain, which is neurogenic pain or neuropathic pain. And what that is that's actually pain experienced by this nerve because of the pressure that's being applied from the disc itself. This is also the reason why most of the symptoms that are related to these problems don't just stay with the back. So if I have this problem in my lower back, I'm not just going to have low back pain usually. There's a really good chance that I'm going to feel symptoms such as sciatica, which is pain that shoots down the leg, or weakness or numbness in the leg. You may also notice changes in your bowel or bladder habits because these nerves are what controls those organs. If you have a problem in the upper back, like in the neck area, yes, you probably will have neck pain, but you're also going to experience shoulder problems, probably even pain going into the arms or weakness in the arms. You may get headaches from this, or problems with your vision or hearing or that sort of thing, because all of those things are controlled by the nerves in the neck. Now, the major reason, if we look at that, if we acknowledge that, the major reason that the treatments that are usually recommended for these problems don't work is because they're only focusing on this nerve, and their goal typically is to numb the nerve. So for example, with most medications, all they're doing really is stopping the nerve from experiencing pain, but they're not doing anything to heal the disc basically. So what you'll find is that a lot of times the medications may help at the beginning, but if you stop taking them, they're going to stop helping, and they're not the type of medications that you can take for a long period of time, because a lot of them have some very serious side effects that are associated with them, and so most doctors will not keep you on these medications for the long term. If you look at something like physical therapy, that's a little closer to focusing to the disc problem itself. However, what you'll notice a lot of times with physical therapy is that when you stop, the problem will eventually return because it doesn't actually fix the problem completely. The same thing with injections, with cortisone or even with epidurals. All they're doing is trying to reduce the inflammation or numb the nerve, but they're not fixing the problem. And with surgery, sometimes what will happen is they'll come in and they'll remove the disc bulge itself, but the problem is this doesn't heal very well a lot of times. And so with most surgeries, what we find is that if they are effective, the problem will usually return within a short period of time, usually within 1 to 5 years is what we know through research. And the reason is because they're not actually fixing the problem and allowing it to heal properly. So the question is, if these types of treatments are not going to work well for you, what is it that you can do instead? Well, what I've done here is I have created a website for you. It's healyourbulgingdisc.com, and you can actually come here now. And if you look at the description below this video, you'll see that I have a link there that'll take you directly to this site. But what you can do here is I've outlined basically everything that you need to know about these conditions. If you scroll through this front page, you'll come to a point here where you'll see that I've listed out the different conditions that I cover on the website. All you have to do is click on whichever one you're interested in, and what it's going to do is it's going to take you to a page that gives you information about the problem. So let's go to the first page first. My computer's moving slow today. Sorry about this. Okay, so when you click on the condition that you want to learn about, it will take you to an introductory page that'll just tell you a little bit about the problem itself, and it'll show you some images and that sort of thing so you can understand what's going on with the problem. And if you continue scrolling further down, you'll see that I have a table of contents here, and what I've done is I have basically outlined everything that you need to know about these problems. So, for example, we talk about what the different problems are and how they work. We talk about the different types of pain, which is what I just talked about with you, symptoms, causes, and treatments. Now here's where I go into a lot more detail about what you need to do differently. And I break down all the different medications that you might possibly be prescribed. I explain how they work, side effects, drug interactions, and that sort of thing. I also, further down here, we talk about some alternatives to those medications that are a little bit more effective usually, so that you have some options available to you. Talk about some exercises that you should be doing in order to benefit your problem and help it heal a little bit more quickly. And I cover surgery, and we talk about success rates, what does the research say about it, and that sort of thing. And then if you're looking for further information, I actually have a program, which is the last link here. You can click on that, and what it is it's a step-by-step program that I use personally with my patients, and I have a very high success rate with this problem. And you can learn about those steps just by going to this last page here and clicking on that link, and it'll take you to all that information that you need to know. So, alright, well, I hope you enjoyed this video. I hope you found it helpful, and I wish you luck with healing your disc problem. And I want to thank you for taking the time to watch this video, and I hope you have a great day.